Welcome to Magnolia Medical Minutes, your local source for expert medical insight direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of Super Talk Mississippi Media, and today's special guest is gastroenterologist Dr. John Phillips. Thanks for joining us today, Dr. Phillips.
Thanks, Andy.
So today's topic is colorectal or colon cancer. What is colon cancer and how common is it?
Colon cancer is one of the most common cancers in the United States. It's completely preventable by undergoing a screening colonoscopy. The majority of people that develop colon cancer, that cancer comes from colon polyps, which are growths in the colon. The way I like to explain it to my patients is a polyp is it starts out like the size of a green English pea. And then over time, months to years, that growth gets about the size of a grape. Still benign, but getting larger. Over time, again, months to years, that becomes cancerous. So when we perform a screening colonoscopy and we find a polyp in the pea or grape size, or even bigger than a grape, we can remove it, and then the logic is we prevent the development of colon cancer.
Who is most at risk, and what age should people start screening for it?
The GI professional societies, for several years, you get a screening colonoscopy starting at age 50. But we started finding colon cancer in younger and younger patients, so the societies changed the guidelines and lowered it to age 45. And screening colonoscopy means you're not really having any symptoms. And importantly, a family history of either colon cancer or colon polyps, such as a parent, a sibling, or a child. And I even think it's important if it's a grandparent or uncles or aunts, that raises the specter to be sure that you get tested.
So tell us, what are the screening options?
So there are stool tests such as a stool hemoccult, or you may have seen the Cologuard test advertised on TV. But as a gastroenterologist, I feel the best test is a colonoscopy, because colonoscopy, if you find something, you can do something about it at the same time.
What are the symptoms and warning signs that simply should not be ignored with this?
What I hear most commonly is somebody has noticed blood in their stool, and they'll a lot of times attribute that to hemorrhoids. Well, it may just be hemorrhoids, but it may be something else. So then you also want to worry about a change in the caliber of the stool. Are you having symptoms of fatigue due to being anemic because your blood counts are low because you've got a bleeding colon cancer that's hiding in your colon?
Well, thank you today for your time.
Andy, thank you.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight direct from the providers at MRHC in Corinth.